Hi everyone, today we're going to cover if you should even market if you're a dentist. Now, this is a question that many dentists should be asking themselves, but unfortunately aren't. Many people, especially or dentists, when they look at their calendar, maybe they see the next couple months, it looks maybe a little thinner than they want it to be, or their new patient flows aren't what they need to be or what they want them to be, and hence need to market to get more patients. There could be an underlying problem with that. So today we're going to look at that, see if you really do need to market or if there's some other things that you need to do in order to lay the foundation of your practice in order to market. So without further ado, we're just going to jump right into it. So this is a quote from Dr. Abernathy. He is a dentist down in Texas. He gets about 200 to 250 new patients every single month. I wanted to say this up front so you know this quote is accurate and is coming from a qualified place. So good practices don't need to market but should. Poor practices need to market but shouldn't. We'll jump into the difference here in a little bit of good practices versus poor practices, but this is evident among every practice in the US. Either you're in one category or another when it comes to marketing. You either are in a place to market or you're not. There's not really a place in between. So we're going to jump into what this looks like. So you should not run ads for your practice if your patient experience is lacking. Now, this is what Dr. Abernathy meant by good practice versus bad practice. If you're struggling with getting good reviews on Google or even Yelp, then it's going to be difficult for you to grow because you're not getting the referrals that you need. You're not getting the word of mouth patients that are necessary in order to expand, in order to fuel the growth of your practice. If you have maybe an issue with something else, maybe the workmanship or even the person answering the phones is rather cold, this all has to do with patient experience. So if this is off by any means, then it's going to be really difficult for you to market because it's going to be like a negative feedback loop. So no matter how many patients I or someone else brings you, it's not going to solve the problem because you're just going to end up getting more negative reviews or more of the same thing. And if you're in that place of a bad practice, you're just going to get more bad. So that's the first thing I wanted to cover. So the second thing I wanted to cover when it comes to why you shouldn't run ads is if you have incorrect expectations. Now, I have the picture of the gym here for a reason. I thought this would be an appropriate illustration. Usually when it comes to the gym, people think, you can lift weights for a couple days or a week and then you'll start to see results. Unfortunately, it doesn't work like that in the gym, and it also doesn't work like that in marketing. It's usually a process. It's slow and steady. Just like really anything worth getting in life, it's going to not come to you overnight. It's not going to be an overnight, success if you want to. Usually if something's worth getting, it's going to be a process and it's going to take a while. One thing I want to mention about that is a lot of people compare SEO and paid traffic. They say, well, if it's paid traffic, then you should be getting results from day one. Although you'll be getting patients within the first month, it's not going to be extravagant or it's not going to be over the top, exceed your expectations if there's not a lot of energy being put into it. Meaning if the ad spend is low, if the strategy is off, then it's going to be difficult to get results. Same thing like the gym. If you only do a couple bicep curls, your biceps aren't going to grow too big. Same thing with marketing. You really get out of it what you put in. The third and final thing I wanted to cover is not having systems in place to handle your leads or to handle an influx of new patients. This is a great thing to cover, especially a lot of dentists when they first run ads, they don't have the capacity to reach out to the amount of leads that they're getting or to properly put them through a sales process in order for them to either convert to care or to be a loyal bread and butter patient, if you will. So not having the systems either with your front desk, following up with the leads, or like I said, presenting cases, making sure you're having a high enough case acceptance rate. If you don't at least have a thought of how you want to run that. If you don't have anything set in stone, if it's kind of like they're just showing up and you don't have any of the numbers on how many people came in, how many of them actually converted to care, then it's going to be difficult for you to scale and grow. Now, right now, you really have two different options. You can either try and do this yourself on your own, try and go through all the videos on YouTube, trying to learn about how to set up a Facebook pixel, how to create a marketing strategy, how to set up a Google Ads campaign, how to try and do all this on yourself or on your own, or you can work with me. If you work with me, it's going to be a lot more fun than just trying to figure this out when you don't have, or when you have time around your office hours and you'd rather be spending time with people that you love or spending time doing the things you love. If that resonates with you, if you're interested in that, I do have a link in my description below. It's going to be a 15-minute Zoom call, a conference call with me. We're going to look at your practice, look at your strategy, and if it looks like I can help you, I will. If not, I'll give you as many tips and the advice that I have to give to you at the moment, and we'll go our separate ways as friends. Thank you so much for watching the video. Feel free to subscribe, like the video, and consider commenting if you have any questions related to this video. Thank you so much again, and enjoy the rest of your day.